the first time I heard anything about the coronavirus was about the middle of January. People started talking about it. Some modelers put together the first epidemiological model of coronavirus, and that's what caught my eye. So back in late January, I was seeing articles like this one, and I actually last quarter, winter quarter, we talked about coronavirus a little bit. I didn't know how bad it was going to be, but from everything the modelers were saying, I knew it was going to be bad. Unfortunately, I didn't know it enough to sell all my stocks at the before everything hit. So, well, no one's perfect, but we knew it was going to be bad because the models told us it was going to be, and these are very good models. We'll talk a little bit what goes into them, and how we can interpret the real data that's coming in, like the number of new cases per day. I made this a couple of weeks ago, anyway. So we'll talk a little bit about the COVID model. If you have questions, we can talk more. But I am probably going to want to talk more about this on Thursday for anyone who wants to join in to sort of an open office hours discussion. Completely optional, has nothing to do with any requirements of class. It's just what's interesting right now. All right, so we look at all this data that comes out there, and you see, whenever I look at the news, I see predictions that come from these epidemiological models, and the curves look something like this. They have the number of new cases, and we expect it to peak sometime in May, and the number of deaths increases over time, and you see these curves over and over. They talk about flattening the curve. They talk about the shapes of these curves and who's gotten to the peak and who's not to the peak. And sometimes they show a logarithmic curve. They're doing a good job presenting the results of the models. We're going to talk about what goes into the models, so you can interpret these maybe a little easier. Anyway, so for someone to get infected with coronavirus, you have to have a susceptible person and a person who's infectious. And when they come into contact, there is a certain probability that the susceptible person will get infected, will be exposed anyway. They'll be exposed to the virus. They get the virus in their system. They are not, you get a little virus in your system, you are not infectious at that point. It takes a little while for the virus to build up and for the symptoms to build up to the point where someone who's been exposed becomes infectious themselves. But first, you always need susceptible people and infected people to come into contact. So mathematically, here's how we model that. Just like the rabbits and foxes, you have susceptible people S and infected people I. When they come into contact, there is some probability that a susceptible person will become exposed. So that's that term. It's just a mathematical term involving those two parameters. The probability of that infection depends on the number of contacts that people come into contact with every day, and the probability of any individual contact exposing the susceptible person to the virus. So those things can be changed. We'll talk a little bit about how you can change this parameter beta by changing, by doing things like shelter at home and social distancing. Okay, so now these susceptible people have become exposed. So there's going to be a rate equation for the number of exposed persons. E is the number of exposed persons. And that number is going to grow every time the susceptible population decreases. They just move straight into the exposed population. Those who are exposed also slowly over time develop symptoms and become infectious themselves. So that process of becoming infection is this progression rate K. And every person who's exposed will slowly go through this. And as they become exposed, as they progress from being exposed to becoming infectious, you see that same population, K times E, is added into the infectious group. So basically, people are just moving from one group, susceptible to exposed, to infected. And infected people eventually, over time, they recover. We'll just look right now at the removal rate, gamma. They're removed from the infectious population, so they're no longer infectious. Well, what happens to those people? Two things happen to those people. Either they recover and they're okay, or they die. Most people recover, by far the greater number recover, but there are deaths due to any flu, and even more so, we think, with the COVID-19. So if you look at the probability of death, someone who's sick might have a probability of death of 1% or 0.5% or something like that. So everyone who is removed from the infectious population ends up in either the recovered or the mortality statistics. And we have rate equations for both of those. So everyone just moves slowly from the susceptible category over towards the recovered or dead category. It's one directional. If having the disease once makes you immune to getting it again. If there's a limited immunity, people in the recovered category will slowly be added back into the susceptible category over time. And this is what happens with flus and the cold and things like that. Not always because immunity doesn't last, but because there are changes in the virus. And as the virus changes, it can slowly adapt to reinfect people. So two different mechanisms. One has to do with the immune system's reaction, and the other has to do with genetic changes in the actual virus. So here's our model. We go through these 4 stages: susceptible, exposed, infectious, and recovered. And this model in general is called an SEIR model. There's a simpler one, SIR, we'll look at in a bit. But each one of those populations is governed by its own rate equation. So now instead of 2 rate equations, we have 5 rate equations. They're all coupled together in various ways. And we can solve them in the exact same way we did with the fox and rabbit populations. Instead of 2 variables, X and Y, we have 4 variables here. Well, 5 variables if you count death. And yeah, so we can solve this fairly simply. The parameters I'm giving you here for beta, K, gamma, and the probability of death are parameters more or less determined by modelers who've looked at the statistics that are coming from all the different health agencies. They're looking at mortality, they're looking at infection rates, they're looking at testing rates, and they're trying to come up with what these parameters are. And this, again, is the weak part of the model. It's so hard to determine how many people you come into contact with on the average day. And how does that change over time, depending on the weather or depending on social distancing or different sorts of things. So the parameters are the hardest thing to figure out in this model. The model is stable. This works for all sorts of diseases. It's the parameters that are hard to determine. Anyway, modelers have made estimates of this. Some modelers have different values. And if you look at different model sources, they'll use different numbers here, but they all have the same basic variation here. And they'll all look very similar. If you look at any population, so the blue line is susceptible. The susceptible population starts off at basically everyone, and slowly those people get sick. And as the susceptible population decreases, the recovered population will eventually increase to the point where you get herd immunity, this term that you hear all the time. And herd immunity is what in this particular simulation, this is why the green line doesn't get all the way up to 1,000 and the blue line never gets down to 0. Because at some point, enough people have gotten the virus and have become immune, removed from the susceptible population, so that the virus stops spreading. So herd immunity are these flat lines where the virus has stopped spreading. So I'm going to remove the 2 big lines, the blue and the green lines, because they're so much larger than the actual number of people who are sick at any point in time. And these populations, so the exposed population and the infectious population, the peak of the infectious population will always lag behind the exposed people because you have to be exposed first, then you become infectious. In this case, the infectious population is larger than those who are silently carrying exposed but not infectious, because it actually takes longer. Once the infection shows up, once the virus gets up to a level, it takes quite a while to recover. In this model, I think it assumes 6 days, where it only assumes 5 days for an exposed person to become infectious. So those are determined really by the length of time that someone is in one of those phases. The number of deaths just grows over time and will eventually stop only when the virus stops being propagated throughout the susceptible population. So here's the kind of things you're looking at. Now, all the time we get graphs like this. So I pulled this from, I don't know, I think the New York Times maybe. And this is their new cases per day graph. Well, there is no new cases per day in this figure. It's not part of the model directly. For that, you have to calculate. Here's the term I want. The number of people goes from exposed to infectious. That's going to be the new cases, because that's when generally a case is detected. Only when they start to show symptoms, when they become infectious. And so that term is this red curve down here. It's small relative to the number of people who are currently infected at any point in time. New cases per day is always a small percentage of everyone who's involved, either susceptible, exposed, infectious, or recovered. It's just a tiny little number. So here's that curve, and I've sort of shown it with a time scale here so that you can get an idea. As infections start to show up in the population, it takes somewhere more than about 2 months before you reach the peak. The virus started to show up in California, we know now, somewhere in early January, but started at such a small level, and the spread of the virus was slow enough that it actually took a while before it started to build up any real momentum, kind of in that sense of the continuous versus discrete versions of the solution. It was a discrete problem that just jumped here and there when there were very, very small numbers of infectious people. As community spread happened, you start to get into these models. So community spread in California started happening really in early February. And the model says that somewhere between 2 and 3 months from early February, California should hit the peak of the outbreak. And that's pretty much right. 2 months from then is the middle of April, and supposedly we are at or just past the peak in California. So you kind of get an idea what's happening. There's some confusing things here. Like, for instance, if I look at this graph, actually, this is not California. These are US numbers right here. I'm looking at that 20,000 cases per day. These are entire country. And there's an interesting thing here where it almost looks like it reached a peak, but then it's going back up. And that's because these are detected cases. We don't know what's really happening with the population because we can only detect those people we test. Testing is far below what you would need to actually determine the number of people infected in the United States at any present time so far. They say that testing will be improved somewhere like the end of May, early June, and then we'll be able to put better numbers to these things for the current state. All these interventions people are talking about, flattening the curve, well, that's when the parameters that we looked at earlier, where they come into effect. And really the parameters that most are affected are the probability of infection. So when you come into contact with another person who is infectious, what's the likelihood the virus will spread from the infectious person to the susceptible person? And that number changes a lot if you have a face mask, if you don't shake hands, if you don't come up and give someone a big sloppy kiss. Avoid those things, and you cut the probabilities of infection for people who you come into contact with. The other thing you can do is reduce the number of individual contacts. If you cut this by 50%, you reduce the velocity of the spread by 50%. It's a direct relationship. So shelter at home, social distancing, all these different sort of personal protection, face masks and gloves, all these things affect P and C in this case, which went into that factor beta. And beta was the rate at which susceptible people were becoming sick. So that's how you flatten the curve in this sense. You can also reduce the number of deaths by having more access, earlier testing, ventilators on hand at the different hospitals. Anything you can do to make sure that people get the best medical care possible, and eventually maybe some antiviral treatments, things like this remdesivir that was developed for SARS. Those may help reduce the death rates as well. So all these things go into flattening the curve. And just to pick some numbers, I picked a few variables in the model. I changed P and I changed C, and the dotted lines are when I use some interventions to try to reduce the number of cases, and by reducing that rate of infection, you change the number of deaths overall, and you make herd immunity occur at an earlier point where fewer people have to be infected before you start to develop herd immunity. So that's the power of flattening the curve. You change these behaviors, and all those are lives saved. People who would not have survived, all the vulnerable populations with pre-existing conditions, older people, they're really the ones that we're doing all these things for, because they are in that interval of lives saved. So basically, I've built this COVID model with the different variables, and if you start to change things in here, you can change the behavior of the system. So in this case, if I change the number of contacts a day, if you just are more careful about who you come into contact with, you change that number from 10 to say 7, well, now all of a sudden you've reduced the total number. If everyone in the country, if everyone in the world reduces their contacts by just 30%, this is what would happen. Now, these numbers are from, the initial numbers are if we did absolutely nothing, if we went about our lives, a lot of people, millions and millions of people would die across the world. In fact, it'd be tens of millions of people would die probably if we did nothing. But if we do just a little bit, you reduce that number, by a significant amount. If you change that number from 7 to say 5, well, you almost, it looks like it's disappeared, but now we're talking about maybe 1 million people dying instead of 100 million by reducing your number of contacts. We can also set that back to the initial number. Let's say we still have to go about our everyday life. We're still going to come into contact with 10 people, but we can reduce the probability of infection here by wearing face masks, by not shaking hands, all those things. If we can reduce this factor by, just from 0.03, maybe we can get it down to 0.02, so less than half the probability of infection. Well, again, we make the problem get substantially smaller by making small changes. What you're doing is you're changing that infection rate, the beta, and if you change the infection rate, you'll change the point at which the population reaches herd immunity. And herd immunity will kill off the virus more or less without even a vaccine. As long as we do these things, infection rates will decrease, and eventually the virus will only be infecting, small numbers of people, more on the scale of what the flu does every year. So that's what happens with flattening the curve, and hopefully these things will help. On Thursday, I might want to talk, if anyone's interested, I might want to talk a little bit about how we actually are trying to come up with better numbers for all the parameters that go into this, because our numbers are they're educated guesses at this point. And they're getting better, but they're still just educated guesses.